a lot of it goes back to like our family doctor was like, it's almost like generational, like he's had like majority of our family as patients, and a lot of family members are fat people. So it's always going back to like, oh, like you'll get diabetes, oh, you'll get this, you'll get hypertension. And it's never just like acknowledging the fact that these are overworked bodies. Where a system, like just simply if we can't access your knowledge, your medical knowledge to provide some form of medical support for us, how do you expect us to continue on, right? It's unfortunate, but that's a reality till day. Like till day, like even now, I now find myself as someone who practices like anti-oppression as a transformative justice tool, you know, practicing that in spaces like medical offices, hospitals, with WSIB, constantly advocating for your own self is tiresome. And I think in these spaces, something they need to recognize is even with developing so-called guidelines on like obesity and things like that, like there needs to be a recognition that our bodies are always changing, right? And the system was never made for us, and that's the truth. Like when we think about raising food costs, you know, gas prices, everything, our lifestyle, like they're so expensive now. If you're constantly pushing this idea of like eat healthy, be healthy, like the conflation of discourse, the discourse of healthism and thinness, it takes a toll on you because mentally, like I know there was a point where I internalized fat phobia, you know, and then you internalize these ideas that because you're not thin enough, you're not attractive enough, therefore no one will ever, for instance, be your partner, your romantic partner, your sexual partner. So there's so many like nuances in terms of like how our body is felt and the way we hold these discourses within us, and we're constantly negotiating with our bodies and with our sense of subjectivity, like, okay, what is it that I require? But what is then, how is that impacted by these larger structures? Oh, 100%. I think like in accessing like things for sexual health, it's harder. I'm actually searching for someone who is fat positive in terms of their practices, like anti-oppression practice is what they hold. So if, for instance, if I am to go into a medical office for like a OBGYN, how are they gonna interpret my body? Like what are their practices there in terms of, am I just another fat person for them, or are they going to bring empathy into the situation where like, let's educate you on what you need, or like in what ways can we support you with what you require in this moment? Because like there are a lot of moments that I've shared with my mom because we've explored these ideas together, but also we've had these sessions together, these experiences like with different medical for professionals, and just asking like, okay, like what do I need to, for example, get like birth control pills because I can't get my period. So it's a larger conversation even with that. Just like, oh, like birth controls are going to make you gain even more weight. So it's always been, there's always some form of linkages to like fatness in that sense. And even in the moment, just trying to, the feeling of being exposed, I think there's a lot that goes around there, like around, goes along with that. The idea of exposure, and then when you're constantly hit with such rhetoric of shame, that exposure just felt, it intensifies.